Good afternoon out there, everyone. Dr. Tony Brown coming to you with another edition of Clinical Pearls and Profits. So today the topic is attention deficit hyperactivity disorder. Which labs do I order? ADHD, which labs do I order? So let's jump right into it. As any of you guys know out there, if you are dealing with patients with ADHD, that the diagnosis of the same is a matter of clinical evaluation, right? Medicine, several years ago, the American Psychiatric Association did make a promise to move towards more evidence-based medicine, looking at lab studies, genetic studies, etc. It has not moved uh, that far in ADHD. That is to say, it is still made only on a clinical evaluation. Now, that would be the end of the webinar today, and we'd have to say goodbye and see you next week, except for there are some labs that you can have drawn that can increase your suspicion of ADHD or decrease your suspicion while helping you to decide on some other differential diagnosis. Okay, so we'll talk about those. A quick 2 words, though, about those clinical evaluation prerequisites. Everyone is familiar with, the normal everyday presentation of ADHD, the inability to concentrate, the easily being distracted, not finishing projects that are started. I just want to mention two that are often forgotten, which is the first is that these signs and symptoms should be observed in at least two settings. In other words, if you have a child who seems to be distracted at school but fine at home, then maybe they're either not interested in mathematics or they're overwhelmed by it. Maybe they are so advanced that they're bored, or maybe they're so far behind that they feel hopeless and they start doing other things. So that's the first, is that you want to make sure that these signs and symptoms are identified in more than one setting. Said differently, at least two settings. And the other is, this is a diagnosis that you really want to make by the time they're 12 years old. Okay, ADHD is something that you want to have diagnosed by the time they're 12. If they are older than 12 and you're seeing signs of ADHD, then think of another differential to move to the top of your list. Okay, this would have been caught long before that time. All right, so let's look at some of the causes of ADHD. Genetics. Parents and siblings of children with ADHD are 2 to 8 times more likely to develop ADHD than the general population. Now, that suggests that there's a real familial correlation that's going on, okay? That is not to say it's necessarily genetic. Think about things like diabetes type 2, right? There's a familial correlation. But you can use this familial correlation to raise your suspicion. When a parent comes in with a child they suspect with ADHD, ask a little bit about the background of the family. Environment. So there are hypotheses that exist, including in utero exposures to toxins such as substances. So let's talk about those, okay? Mommy standing on the corner, catching a bus to work, breathes in lots of pollutants, especially the buses going by, high levels of carbonated pollutants. This can affect baby. Mommy being exposed to cats during pregnancy has a correlation with several neuropsychiatric pathophysiologies, top of the line being bipolar or schizophrenia, I'm sorry. Top of the line being schizophrenia. Mommy being exposed to certain vaccines during pregnancy also has a correlation with neuropsychiatric pathophysiologies, top of the list being schizophrenia again. I'm mentioning those as examples because what you have to think about is we're talking about diagnosing this child before they're 12. So evidently we expect these signs and symptoms to show up early in childhood. Something showing up that early in childhood, there's quite a chance that it had a head start in the womb, right? So what does that mean? Not only will you need to be testing your patient for the things that I have in red here, but also mommy, because we're talking about mommy's exposure being the catalyst here. Food additives, right? There are certain food additives, and there's many books out there you can read by certain authors, Dr. Keach, and I can't even remember all there's books out there. Your Blood Never Lies, The Autoimmune Fix, Cracking the Metabolic Code. These are just some of the examples of books I've seen that explain some of the effects of food additives on kicking off the immune system. And that's the deal, right? If mommy's immune system is activated during pregnancy, what you'll find is there's a plethora of disease processes that the baby can suffer from. So it really doesn't matter what kicks off mommy's autoimmune or mommy's immune system. The fact is that it gets kicked off. Allergic causes, we just pretty much covered that. Let's look at the next line here. However, diet, especially sugar, oh, sorry, let me back up. I forgot to mention another, which is metal toxicity. Metal toxicities, right? It's a very, very big push today for people to measure the trace heavy metals in their body and to detoxify. So the next logical thought is if you have a mommy with a toxic blood system full of heavy metals, how does that affect the baby? Especially when heavy metals tend to adhere to the pituitary gland, right? So you guys already know pituitary gland is responsible for putting out your follicular stimulating hormone and luteinizing hormone, adrenocorticotropin hormone, your thyroid stimulating hormone, your prolactin, and your growth hormone. So it's putting out a lot of things that affect all of the hormones in your body. And hormones affect neuropsychiatry, right? Too much ACTH means too much cortisol. Too much cortisol means you're always in a stressed out level. Always in a stressed out level could be mistaken for ADHD when it's actually anxiety. Okay, get the connection there. It's just one example. Okay, so let's go to the next line. Diet, especially sugar, is not a known cause of ADHD. I know. We talk about our kids bouncing off the walls if they eat certain cereals before they go to school. Solution to that one is easy. Don't do that, right? That's not ADHD because ADHD not only, as we said, has these familial tendencies, but as you'll see in the future slides here, there are also neurotransmitter deficiencies that are correlated with it, specifically dopamine, right? Dopamine deficiency has a correlation with ADHD. That's not the same as having too much sugar. Too much sugar is just too much sugar. Just don't give them that, and good things will happen. According to one study, exposure to secondhand smoke in the home is associated with a higher frequency of mental discord among children, right? You know, every time it comes up on one of your board questions, smoking is always bad. If they ever give you a choice of anything to increase the longevity of life, uh, smoking is always the thing that you pick right off the top. And here you go, you've got a reason for choosing it for your kids too. Okay, so with regard to looking at which labs, let's think about differential diagnoses. So anxiety disorders. Now, anxiety disorders, also it has a familial tendency. However, there are neurotransmitters that you can look at for assessing anxiety disorders. Acetylcholine is one of them, right? I just mentioned another, cortisol, increased levels of cortisol, because cortisol is gluconeogenic, right? It's a stress hormone. More cortisol you have, the more glucose you have. The more glucose you have, the more energy you have. If you have too much energy, too much sugar, that is, it's just like feeding the kids sugar before they went to school. Bipolar, I've mentioned that already. The correlation with having kittens, being around cats and kittens during mommy's pregnancy. Depression, why? Because we just mentioned there is a correlation between dopamine levels and ADHD. So there's a correlation between dopamine levels and depression also. And as a matter of fact, sometimes you'll find both of these on a spectrum. So in other words, when you have ADHD, this is a good time to do a neurotransmitter assay of what? Dopamine, acetylcholine, epinephrine, norepinephrine, serotonin, right? You can check for these things. There are correlations, neurotransmitter correlations with neuropsychiatric pathophysiologies, right? Alzheimer's, decreased acetylcholine. It just goes on and on and on. So don't forget to measure the neurotransmitters. Dysthymic disorder, right? So, you know, it is quite easy to look at. So dysthymic disorders, at least the way that it's being explained here, is on the continuum of depression, bipolar depression, right? It's on the continuum of those disorders. But we can talk about thyroid specifically. You can have hyperthyroidism, which could mimic an inability to concentrate. Because in the end of the day, right, what is T3, T4? It's super jet fuel for all your cells in your body. And so, of course, you could draw your thyroid test. We've often talked about it. I think the most useful slam dunk test for measuring thyroid is going to be TSH, the thyroid stimulating hormone, because that right there is going to tell you right off the bat if something is wrong. Assuming everything else is working right, it's going to tell you if something is wrong up above the thyroid or below the thyroid. In other words, if I measure my TSH and it's increased, what does that tell me? It tells me that my body is using TSH to scream at my thyroid gland because it's not doing its job. It's hypothyroid, which means my T3 and T4 are low. So what did I just say? You look at your patient's labs, if there's a high TSH, you will expect to find a low T3, T4. And then the other one's the other one. If you look at TSH and it is low, your body's whispering because it doesn't need to shout. The reason it's whispering to the thyroid gland is it's already got too much thyroid hormone flowing through the veins. So that means you probably have a hyperthyroid patient, right? And then remember that there are things that will change your thyroid levels, your T3, T4 levels. Estrogen, right? Estrogen will change your measurable free T3 and T4. And so will anabolic steroids that men might take while they're weightlifting. right? Because what happens is when they take these steroids, the body says, great, you want me to make more muscles? I need more proteins. Guess where I'm going to get the proteins? I'm going to get them from the um, thyroid binding globulin. So now you have fewer thyroid binding globulins for your T3, T4 to bind onto, and that means more of them are floating out there free. So you have a change in your actual free T3, T4, but it's not because you're hyperthyroid, it's because they're taking anabolic steroids. Okay, so just another reason to do differential diagnoses on several things. And I know, and I'm going past these things, but guys, this is what we're here for, right? If you're a subscriber with VirtualClinic and you've got a question and need a roadside consult, excuse me, this is what we do, right? You reach out. It would either be myself or Dr. Patel or Dr. Bentley, and we've got no problem in walking you through those zebra patients. Excuse me. As a matter of fact, tomorrow's Wednesday. So they're starting the first of a series of follow-up calls, which means that even if you're not subscribed, um, if you can put it in the chat box here if you'd like, or send an email, whatever. They will reach out to you sometime tomorrow. Give them a good time. They could either go over a difficult patient with you, or they could go over a particular lab that you may have a problem understanding. Cholesterol is a big one, right? Everybody seems to have a little bit of an issue with distinguishing between, the A and B particles of cholesterol. Thyroid hormones, those are usually you guys' bread and butter. Um, yeah, so they don't mind spending 15, 30 minutes. Me neither, except for I have mine that are scheduled for tomorrow. So yeah, if you'd like a little roadside consult on anything, pop it into the chat box here and we'll get it scheduled for you. So that is hyperthyroidism, thyrotoxicosis, same thing to a different degree, right? Sleep disorders. So you've got patients that are going to suffer from, let's say, sleep apnea, right? So sleep apnea is going to increase the levels of cortisol. Why? When you are sleep starved, your body is stressed. When your body is stressed, it puts out stress hormones. Cortisol is a stress hormone, and you know the rest of the story from there. Okay. So who would have thought, right, that all of these things can be connected to measurable lab findings, and all of these things would be differential diagnosis for where we started this day, ADHD. So now let's get down to the nitty gritty. Let's talk about the labs that would be most useful if when your patient walks in, you suspect they may have some kind of ADHD or differential diagnosis going on. Let's talk about thiamine, B1. Okay. Thiamine, you guys are probably used to hearing about thiamine with alcoholism, right? Um, where we talk about Wernicke-Korsakoff syndrome, right? And so remember that, drinking lots of alcohol and therefore decreasing your absorption of B1 can lead to all kind of neuropsychiatric things. We talk about confabulation, inability to concentrate, loss of memory. Okay, so when you are thinking about ADHD, absolutely check all the B vitamins. I'm going to hit them one by one, but check all the B vitamins. Because here's the way I want you to look at B vitamins. The word vitamin is just accidental, guys. All water-soluble vitamins have the same purpose in life. That is, cofactors for enzymes. That's their job. All water-soluble vitamins have the same job in life, which is to serve as cofactors for enzymes. Sure, we stick letters on them like B, that means nothing. It's just language, right? So K, A, D, and E, of course, as you know, are fat soluble. Those are different. But water soluble vitamins are just cofactors. And I say just, I'm kind of underestimating their worth, because if they're not there, enzymes don't work, and enzymes are really important in the body. Okay, let's move on to B12. You want to check that because B12 metabolism, as you know, is responsible for the ability of your body to make myelin. Myelin's that white stuff that coats the axons on the nerves that allows your body, allows, if it's myelin in your brain, it allows you to think quickly, right? The corpus callosum inside the brain, that is that white matter structure that connects your left hemisphere to your right hemisphere. Take a look at Albert Einstein's brain, and you'll see that he had a really big one, which is one of the reasons he was so brilliant, because he could move thoughts from one side to the other much quicker than us mere mortals. If you are missing myelin in your spinal cord, right, this is what causes the neuropathies or the tingling fingers that your patient's going to complain about, the difficulty in balancing. So with B12, the focal neurological deficits that happen in B12, of course, that's not part of ADHD. If they're complaining of tingling fingers and can't balance, don't even go for ADHD. But if they come in and they're complaining of an inability to concentrate, then yeah, think about B12. Take a look at those red blood cells. What are they going to be? Macrocytic megaloblastic. Huge red blood cells is what you're going to find. Let's look at B9. Now, what you guys are used to is this idea that B9 and B12 deficiencies share a common lab presentation, which is huge red blood cells, macrocytic, megaloblastic. And then the way that you're supposed to differentiate between the 9 and 12 deficiency is to see whether or not they have focal neurologic deficits, like the tingling in the fingers. Only B12 has those. B9 doesn't. But listen to this. If you're B9 deficient, that is folate, right? The other word for it. If you're B9 deficient, it is the B9 with a methyl on it that is responsible for giving its methyl to B12, so B12 can do everything I just told you it does. If B9 is not around to give B12 the methyl, then B12 can't do its job, and you may as well be B12 deficient. So that's why I wrote it like this, that B9 may mimic a functional B12 deficiency. You're not really B12 deficient. It's just the stuff you have. You can't really do much with it. Yeah, I know you have 6 to 9 years of B12 stored up in your liver, etc. I'm talking about after that time. So, I see your questions out there. I see you, Daleen and Trevor, and there was another person. I'm going to make it down to those. Electrolyte levels. No, I'm sorry, porphyria. So B6. With B6, as you guys know, if you want to nerd out for a moment, with B6, that's really, really important with heme regulation. Because when you start with succinyl-CoA coming out of that tricarboxylic acid cycle, succinyl-CoA, when you add it to glycine and aminolevulinic acid synthase, it needs B6 as a cofactor so you can make ALA, aminolevulinic acid. ALA is what you need for porphobilinogen, which is what you need to make heme. If you're missing your B6 cofactor for that ALA synthase enzyme, if you're missing that, then you have what's called porphyria. You have a buildup of some stuff inside of your mitochondria that when it does build up, one of the side effects is loss of concentration. What did I just say? B6 deficiency can lead to a loss of concentration. Okay. Electrolyte levels, especially sodium. Sodium's the big one. Too much sodium or too little sodium can affect your level of consciousness and ability to concentrate. Liver function. So this more has to do with after you've decided that they are ADHD, then you're going to have to give them stimulants, and you want to check out the liver before you do that. And then we've already talked about thyroid function tests. So we've got about 3 minutes here, and I'm going to go back up and get these questions. So, hi, Dr. Brown. If someone develops ADHD because exposure to smoking at home, will that person's future child develop ADHD? Will environmental acquired disease be expressed as a genetic disease in the next generation? Love the question, Dailene. I did some research at Columbia University of blah, 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 and physicians, and also at the Neuropsychiatric Institute in Columbia University. And the argument there, at least with the boss that I was working with, is yes, right? And I'll tell you how. Let's start with cortisol. The way cortisol works, as you know, is it works by changing your actual DNA, right? Remember that mechanism for your boards of cortisol, steroid hormones diffusing into the cell, and then they hook up with this receptor. The receptor dimerizes. The top part of the receptor translocates into the nucleus and then binds to the hormone response element on the DNA. It binds to the HRE on the DNA because it is going to change your DNA. That is what hormones do, cortisol specifically, I'm mentioning. So now what you have is a change in your DNA. And the question is, if you go long enough with these changes in your DNA, can it affect your child's DNA? Absolutely. That's the short answer. It takes a longer conversation about epigenetics, but it's still going to come down to the same answer, which is a yes. Can you repeat the cortisol and ADHD interaction? Sure. So too much ACTH is too much cortisol. Too much cortisol keeps you in fight or flight because it's a stress hormone. When you're in fight or flight, the last thing your body wants to do is to memorize the second theory of thermodynamics. So you're not really spending a lot of time memorizing stuff. You have memory problems because your body is busy running from the dinosaur, because surely that's the only reason you have high levels of cortisol. So this inability to concentrate because of a prolonged fight or flight could be mistaken for ADHD. And let's see, I sent Ryan an email about my patient. I won't read the name. I'm also going to send my patient that name to get his thoughts. Does he have time today around 5 or tomorrow? I actually don't mind any of the docs. I just have Ryan's email. Yeah, well, I'll tell you what. Why don't I do this? They'll be starting it tomorrow. So I will send Ryan an email today with those two patients' names. And let me see. Yeah, because you could probably cover it easier with one person. Now, as you know, he's in his second year of residency. So let me think. When did you send the email, Trevor? Because I know he just got off of night shift is why I'm asking. Okay. Yeah, right when you change shifts. All right, so what I'll do is I will send him an email today with these two patients' name. He should give you a call tomorrow. So that's for Dr. Bentley. Anybody need a consult with Dr. Um, Patel? Problem patient. All right, good deal. Okay, guys. So that is this week. Next week, we'll be doing what is ever on the list. I will be going down the list for the next several months. It's just in alphabetical order. So just watch for your mailers when they come out. And if you're interested in the stuff in the topic, tune in. So yeah, you did it one more time. You wasted an entire half hour of your life nerding out with me. I appreciate it. So see you about 7 days from now for another edition. Okay. Have a great week, guys. Bye bye. I see you, Michelle. I'm just now reading your comment. It just popped up, so I did not go anywhere. One moment.